So the early symptoms are generally in the presentation, and the history is usually from the parents where they notice, a curvature in the spine or asymmetry in the chest, or the fact that when they put on the child's clothes, particularly with trousers or nappies, that they're lopsided. So that usually alerts most parents to the fact that there may be something going on. And then over time, if those appearances seem to get worse, then a lot of parents will will come to the doctor. So usually, if they present for the first time and it's very early on, then there's the option of monitoring, just monitoring the situation to see if it will get worse. If there is worsening of the scoliosis, then at a very young age, the treatment options consist of either applying a plaster jacket serially, which means that you put the jacket on under a general anesthetic, and then every 3 to 4 months, the jacket is changed to keep up with the growth of the child. And then when the child is a little bit older, you can then move on to plastic jackets, which are like corsets that support the trunk and help to control the scoliosis. And then if bracing fails, then you can then start to open discussions about whether surgical correction or surgery is necessary. And generally, in that age group, if surgery is necessary, then you talk about using growing rods, which allow control of the scoliosis, but at the same time allow the child to continue with growth and development. And then the growing rods are continued into the early adolescent years, when they can either be removed and converted to a definitive posterior spinal fusion to make sure there's a permanent correction of the scoliosis, or removed and the child just left alone. So that's often down to the surgeon. So the simplest diagnosis is often made by the parents. As I said, they see the deformity and then alert the health professional. So once they're in the hospital setting, then the two main ways of confirmation of diagnosis are physical examination and then radiological investigation. The basic radiological investigation is an X-ray. And on the X-ray, you're looking at the size of the curve, and if there are any other abnormalities that may suggest that there is an underlying condition. So you're not only looking just at the size of the curve, you're looking at the spinal column itself to see if there are any abnormal vertebrae. You're looking at the ribs to make sure that they're equal on both sides. You're looking at the pelvis. You're looking at the size of the chest wall. So there are different things that you look at, but basically the physical examination and radiological investigations. So I suppose this is a controversial area, and in recent years, a lot of new, if you like, therapies have come into focus in terms of managing scoliosis. So there's physiotherapy, and then there's a newer form of therapy called the Schroth method. That's SCHROTH. and the Throth method focuses on exercises in and around brace control. And the exercises, they're intense exercises, often lasting hours each day for many weeks, to try and bring about a control or correction of the scoliosis, and also improve breathing. So I think the jury is still out as to whether the traditional physiotherapy is more effective than the newer therapies, but generally speaking, it's not a bad idea to try exercises to help maintain the curve, in addition to the more traditional approaches like bracing or plaster jackets. But it's also important to bear in mind that sometimes, despite these therapies, the curves will still progress and may eventually require surgical intervention. Well, the main complications, if untreated, is that firstly, if untreated, the curve has significant potential to get worse, particularly at that age where a child is still growing and developing. So, and if unchecked, that can lead to problems with breathing, problems with the heart, even problems with feeding. And by default, can then cause problems with growth and development, not just physical, but psychological as well. Because these children are often afflicted with respiratory ailments, which can keep them out of school. They may feel isolated from their friends, because they're in hospital all the time. There's a risk that it could have an impact on their cardiac function. And then even in some cases where you have very severe curves, it can affect their feeding habits because the stomach is squashed. So instead of having sort of regular meals, they tend to have smaller and frequent meals. And all that added together leads to a lifetime of ill health, and even in very severe cases, earlier mortality than the general population.